Hello. Now today we are going to check on uh, what we call pregnancy or diagnosis of pregnancy. This is in midwifery or reproductive health under nursing, under faculty of nursing. So this is Auma presenting, and we are going to detail diagnosis of pregnancy. Previously, we talked about normal pregnancies. I mean, terms used in normal pregnancy. We define normal pregnancy, and actually we had a lot on the same, so you can just go back on the YouTube and check the last week video on midwifery. You'll get that coverage. So today we are going to check on diagnosis of pregnancy. More often, if you're in consultation room, or maybe if you're working a facility, some strangers, any person can come and ask you, how will I know that I'm pregnant? Okay. Some few people will come with confirmed symptoms. They'll tend to be anxious about their condition or state. They'll be worried because of maybe morning sickness. Some of them may be having funny or maybe a missed period. So, how are you going to diagnose a pregnancy in this case? Are you going to rule in pregnancy and rule out any other possibility? So, by the end of this topic, you will be able to describe diagnosis of pregnancy and outline estimation of gestational age. So, we're going to check how we can know a mother who is pregnant. How old is the gestation? Is it 2 weeks old, 10 weeks, 20 weeks, or and how is that one practically being done? So, that is what we're going to check here in this YouTube. Piece. Diagnosis of pregnancy. The average duration of pregnancy to 80 days or 40 weeks. To 80 days or 40 weeks, okay? And if you talk about 40 weeks, that is almost 9 to 10 months. So to correctly calculate, you need to get first day of the last normal menstrual period, or what we call the Naegele's rule. A Naegele's rule, we are going to check it at the last stage. But as per now, what is important here is diagnosis of pregnancy, which can be made through the following approach. So the first thing, history checking. The mother is there. The mother has come to your facility. There is a complaint. There is a history of missed period. There are some morning sickness such as nausea, low abdominal pain, some mild headache, loss of appetite, blah 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 blah. So that one also come into play. So that is one comprehensive thing. So history taking is one of the diagnosis process. So you have to take a history of the mother. Physical examination, as a medic, as a physician, as a doctor, as a nurse, you have to confirm by head to toes. You have to see how the mother is presenting in terms of in the physical aperture. The abdomen, is it distended or not? Okay. Some pregnant women come with very dried lips, especially in local village Uko. Okay. So after that, we do laboratory investigation. We have pregnancy tests. Some of you call it PDT. PDT means pregnancy diagnostic test. So with that, you get to know that is now you want to confirm completely that this mother, despite the history that I've received physical examination, this test is positive or negative. Whether the history is there, because nausea can come along with many other underlying conditions. Okay, people have nausea, even some parasitic infection or bacterial infection will bring nausea. Okay, head injury can still give you nausea. So all that one comes into play. So you have to confirm by laboratory investigation to maybe to get it exactly have a definitive diagnosis, and that definitive diagnosis will now help you to render the result and follow, maybe initiate what we call the antenatal clinic or something else. You can also advise and counsel based on the result. Apart from laboratory investigation, we can go for radiological test. We can have X-ray, the abdominal X-ray, whereby ultrasound can also be used. Ultrasound is always preferred than X-ray. Ultrasound will really give you a good output in terms of the visualization. You will be in position to see the fetus heart, how it's what you can even get on the sound and the consistency of the heart rate of the fetus. So it can also ultrasound can also be used to know or determine the gender or the sex of the fetus. Okay. Sign and symptoms. Still in history taking, sign and symptoms also there. We can also use them. So the part of this lecture will discuss sign and symptom of pregnancy in details. Okay. So after this, each student is to read more on other approaches in pregnancy diagnosis. So let's start with the sign and symptoms of pregnancy. So signs and symptoms of pregnancy are categorized into three groups. That is possible signs and probable signs. and then positive signs. So we have probable signs, positive signs, and possible. So the first one is possible signs, what you can as well call presumptive signs, and then probable sign and positive sign. We're going to check each of them. So let's start with the probable sign or presumptive sign. So mothers do come in your outpatient facility. Okay, some have already had some symptoms. So these are the signs reported by the women when they come. They are signs that accompanies pregnancy, but there are other causes to this sign other than pregnancy. So, for example, amenorrhea, that is a missed period. Not necessarily that not apparently that a mother will come with a amenorrhea if it's pregnancy. Sometimes there might be some underlying condition, maybe endometriosis, maybe ovarian syndrome, maybe hormonal imbalance. So all these one can still attribute to amenorrhea. So amenorrhea is not consolidative. You cannot use it exact on the pregnancy. Amenorrhea is just like any other sign, but it is very significant when it comes to that. So that is under possible signs. So amenorrhea, 4 weeks plus, but may have other causes like stress, breastfeeding, menopause, anemia, contraceptive use, emotional stress. All those one can result to missed period. But then it is under possible signs of pregnancy. Morning sickness, still under positive side. So up to 4 to 14 weeks, especially nausea and vomiting from 6 weeks due to gastric upset related to human chronic gonotrophic production. So that is that. So what I'm trying to say, we'll have morning sickness, nausea and vomiting comes in from 6 weeks due to gastric upset related to the human chronic growth. Because during pregnancy, the ACG are always elevated and they are in the system. So within the systemic circulation, they get to disrupt some normal physiology. So get the gastric upset, and with that, there will be probable sense of nausea and vomiting. So differential diagnosis still can be as a result of indigestion, emotional stress, appendicitis, which can still give us nausea and vomiting. Okay. Another one is frequency in micturition or bladder irritability. Bladder irritability or frequency in micturition is that tendency to pee, to pass urine frequently. That always happens between 6 to 12 weeks during gestation and due to increased vascularity and pressure on the bladder because that baby is growing, and so the baby is occupying a space in the abdominal region, and therefore there will be a lot of pressure in the bladder. Even the volume which was supposed to be filled with the bladder will be reduced by the growing fetus. With that, the pressure will overload on the bladder, and then you'll be not able to contain urine for long without the sense of passing it. Okay. So other than pregnancy, this can also be caused by frequency micturition, can be caused by diabetes mellitus. They always have what we call polyuria. Polyuria is also the same with frequency maturation. They will frequently go to they will go to pass urine, and they'll be going frequently, and they'll be doing a copious amount of urine. Yeah, urinary tract infection (UTI) or urinary system tumors can as well give us frequency. So that is why it is a possible sign, and it is not a probable or positive sign. Talking about breast changes, 3 to 4 weeks. Due to vascularity, that is increase in blood supply within the breast, primary areola become more pigmented and what we call the Montgomery tubercles are more marked. However, you can go and check on Montgomery tubercles because they are in Google in image format. So you are going to be in position to check them out when you Google that name, Montgomery tubercles. So, however, this can be caused by hormonal changes, contraceptive use, among other things. So it is not positive or probable. Okay. Skin changes at external genitalia and anal area become darker due to increased vascularity. At 12 weeks, you'll get the vagina region, genitalia darkens, and abdomen may have a stria or linea nigra. That's one line that's cut straight from the upper part of the abdomen to the lower toward the pubis region. No? So we call it the linea nigra, and the stria will also come. These are stretch marks. Stria are just stretch marks. Okay. So skin changes in pregnancies mainly due to increased production or sensitivity to what we call adrenocortical hormone. So adrenocortical hormone during pregnancy will bring that one. Okay. So that is always what will come to play. Okay, so skin changes may not be definitive sign of pregnancy since it can occur due to Cushing syndrome, people who have corticosteroid condition or cortisol, hypercortisol secretion, or let me say exogenous cortisol production can develop Cushing syndrome, and They can develop Cushing syndrome, and with Cushing syndrome, you can also still have some stria. Okay, you can still have some skin changes. Okay, okay. So the skin, the stria or the stretch mark, we call the stria gravidarum, that is specifically for pregnancy. But we can still get stretch marks in Cushing syndrome. Okay, sudden weight loss also can also come along, which is not typically for pregnancy. Other skin changes seen in pregnancy include what we call chloasma, linea nigra, strigravidarum, stretch marks, and spider telangiectasis. And you know, spider telangiectasis also there in hepatitis B, people with liver cirrhosis. Okay, quickening. Quickening is another. I mean, is another possible sign is a feeling of life within the uterus and occurs at about 16 weeks gestation. And this can also be caused by intestinal movement, so it is not probable sign. Quickening is that tendency when you're saying that I have quickening, it means the child is playing within your uterus. So you'll feel like you have a life. Might be kicking, might be rolling, might be doing funny thing inside your uterus, and you can feel that is quickening. 16 to 20 weeks. Then you have what we call leukorrhea. Some of the women they mistake this one for sexual transmitted infection. You will get to have discharge, leukorrhea, whitish and thick discharge from your vagina. This occurs mainly due to hyperplasia of vaginal epithelial cells and also due to cervical changes as a result of increased hormonal levels during pregnancy. So it can also be as a result of vaginal infection and vaginal irritants like deodorants and all those soaps. Reagents, okay, soapy reagents. So leukorrhea is also a possible sign, though it happens if you're pregnant, but it can also happen in other conditions. So it is not a diagnosis of pregnancy, but it is a possible sign. Okay, so let's go to probable signs. These are signs that are highly suggestive of pregnancy. However, they are not specific, definitive to pregnancy. Okay, so they are very suggestive. They are more suggestive than possible. Probable signs are more suggestive than probable. Possible. So possible, we've already talked about that. So we are in probable, okay? And I've said probable signs are more suggestive than possible sign. So this include enlargement of the uterus. It becomes globular in shape, and this sign might also be as a result of uterine tumor. So it is not yet definitive sign, or it is not what we call a positive sign. Okay. Cervical becomes soft. This is what we call the Haggard's or Goodell signs or Ladin sign. The Ladin signs, the Haggard's or the Goodell's cervix becomes soft. On bimanual examination, a firm cervix is felt softer body and compressible. Softer isthmus is about 6 to 8 weeks. Although this sign is associated with pregnancy, it may also occur in pelvic congestion, but it is always associated with pregnancy. The Haggard's and Goodell's or Ladin sign. In MCQ, will be asked, what is Haggard's sign, or which of the following denote a cervix which is soft? You will forget about the Goodell's sign, Ladin signs, and the Haggard's sign. Darkening of the vagina, what we call the Chadwick sign, the darkening of vaginal mucosa from 8 weeks. Okay, so it reaches maximum intensity at 16th week and then persists throughout pregnancy. It's also known as Chadwick sign or Jacquemus signs. Okay, so it is also known as Chadwick sign or Jacquemus sign, which is the darkening of the vaginal mucosa. It can be darkening, can be bluish color, and congestion of the vulva and vaginal mucosa. Maybe we also still have pulsation in fornices or Osiander sign. When this is due to pregnancy, it occurs at around 8 weeks. However, this can also be due to pelvic congestion, similarly to the other Chadwick sign. Okay, so pulsation in the fornices, the Osiander sign. Osiander sign. Luo people will not forget because this is a meaning. That's a meaning in Luo. Immunological tests in which the HCG secreted. I realize some people were actually debating about this. Is HCG a positive or a probable or a possible sign? This is a probable sign. Immunological test in which the HCG secreted by the blastocyst is found in woman's early morning urine. Blood specimen as early as 2 weeks gestation. You see, blood specimen 2 weeks gestation. But trust me, for urine specimen, earlier than 2 weeks, I tell you, and it is very accurate for urine than blood. So most rich people will come and tell you, nataka ile ya damu, yani I need that one which is using blood, that one which is done by whole blood specimen. You will not contradict them, or you'll not even reject them or rebuke them or send them away. You'll just do. But I will tell you to the public, I will tell you to the public, I will tell you the public that the HCG is a probable is a probable sign, and it is suitably being tested via urine sample than blood sample. The urine is so accurate. However, ECG does not always give a definitive diagnosis of pregnancy. Why? It is also found in women with what we call choriocarcinoma and iridotidiform mole, hence making this test not specific to pregnancy. Talk about internal ballotment may be done from 16 weeks, but this may be difficult in primigravida and fat women, so that normally is not being done. Talk about McDonald sign, that is ease in flexibility of the body of uterus, that's still under possible. Irregular softening and enlargement of the uterine fundus, we call it the von Fedwald signs. Uterine contractions elicited by manual examination, we call that one Palmer's sign. Piscasek sign, it refers to the palpable soft prominence in one of the location where uterine tubes meets the uterus, what we call the conua. Yeah. And then earlier bleeding that may associate within implantation process. We always have what we call implantation spotting. By the way, some people mistake that they are not pregnant because they have seen some small blood coming out from the vagina. This light and blood, light like very light blood, is not like normal menstrual period or menses. It's a bit different. Some of it can be a bit dark, but most cases it's very light in color. It's called implantation bleeding. Okay, so early bleeding that may associate with implantation process like Atman sign. This is not a specific sign to pregnancy, as it may be as a result of other causes such as tumors and infections of reproductive tract. Talk about Braxton Hicks contraction. Braxton Hicks contraction at 16 weeks. That is irregular painless contraction that may be felt upon palpation. If you touch them, you'll get that pain. The contraction initiate by itself, called the Braxton Hicks. They prepare the uterus for labor as well as facilitating circulation of the blood to and from the placenta. However, this may be confused with intestinal movement. So, then let's go to positive signs. Positive signs now, these signs that confirm existence of pregnancy. When you do these signs and you find them, they're positive, you are good to be pregnant. You're already pregnant. There's nothing else. Okay? It means that there's no any other alternative diagnosis in presence of these signs. And they include visualization of fetus through ultrasound or X-ray. That is very confirmatory. Presence of fetal heart sound through ultrasound or fetoscope. That is positive. Palpable or visible fetal movement, that is also very significant. Palpable fetal part, that is also. So that is that. So let us check at estimation of gestational age. Let's see at estimation of gestational age. Now, gestational age, gestational age, gestational age can be estimated through. It can be estimated through many things, but I want to talk about Nagel's rule. And we can first estimate gestation age, that is the period or the mimba ni, yani kipindi cha ujauzito, like what period have you taken with the pregnancy is what we call the gestation, because gestation period, the period from the conception up to delivery, that duration is always 9 to 10 months, or 40 weeks. So how will you know that this mother is at 30 weeks, 20 weeks? So we check on fundal height or use last menstrual period to calculate the EDD. So when you're using last menstrual period, we call it Naegele's rule. And fundal height can also be used. So we use step measure when you're using fundal height to measure the gestation period. So this is the measurement of fetal growth taken from the pubic bone to the top of the uterus. It is done in centimeters, and centimeters are used to determine fetal growth in terms of week. So that is that. So sometimes many books will tell you if the fetal parts are detected at the umbilical cord, it's always 20 weeks already. 20 weeks or 22 weeks. So some people can use fingers. So when you lay your finger, one finger is 2 weeks. You lay it above the umbilical cord or kitovu, the navel, and then you go a bit up until where the fetal part is no longer being detected. So how many fingertips you calculate? You multiply them by 2, and those are weeks. Then you add them to the to the other weeks. I mean to the 20 weeks, because above umbilical cord that is 20. So use of LMP to calculate EDD. This method is referred to as Naegele's rules or Naegele's formula. In this, you take the first day of normal last menstrual period and you add it to 7. You add 7 to the dates and 9 to the months. However, this method is best. So as I'm saying, Naegele's rule, you add 7 to the dates and 9 to the months. However, this bet is based on the normal 28 days. If it is 25 days period, comma period, if that lady's or woman's period or cycle is 25-day cycle, is a different case. So that is Naegele's rule. So menstrual cycle, for example, if the last period is this one, then the ADD will be this one. ADD means expected date of delivery. Use of radiological tests such as ultrasound or X-ray can also determine the gestation age. That is all for today. Prepare for MCQs.